Thank you all so much for coming. I am Taraneh Shirazian, and I am proud to serve as the director of the Center for Fibroid Care. And we are here tonight because we are talking about all things fibroid. And we decided that our very first event was really about all the information related to every type of procedure and option, medical management and surgical management. But wouldn't it be so much better if we got to hear from people who had been experiencing fibroids, what they've gone through, what they've been through, sort of their journeys with fibroids. And that, I thought, could really help a lot of people better understand, what they're going through and sort of how to make choices for themselves. So this is really about building a community. It's about making everyone feel that their questions are answered, that they're heard, and that we sort of are always pushing the envelope to do better and make sure that everyone gets all of the care that they need. So that's really why we're here tonight. So I have an amazing panel. And I'm going to actually start with Tanya here, Tanya Leake. And I am going to introduce her because she is an advocate for a group called the White Dress Project, and I'm sure she'll tell you a lot more about it. And I had the wonderful opportunity to attend a White Dress Project event, which was amazing. And they are all about building community and advocacy and making sure that women are heard and making sure that women feel part of a community too. So I feel like we're just very aligned. So as an intro, this is the intro for Tanya, and I think it's wonderful. Train powerfully, nourish joyfully, recover peacefully. That is the philosophy of Embody Well and its founder, Tanya Leake. Tanya is a greens-eating, recipe-trying, loud-laughing, dance-performing, self-loving, yoga-practicing, national board-certified coach who is passionate about supporting others in rediscovering their best, healthiest selves, and practicing what she preaches through her health and wellness coaching and programming, specializing in nutrition, stress, distress, and recovery. She practices from a belief that the key to being well lies in approaches that incorporate both body and mind. Her experience with fibroids, culminating in a myomectomy for her 16-centimeter fibroid in 2016, led her to explore the holistic perspective of fibroids as connected to one's love relationships, especially love for self. So we're so excited to have Tanya with us because not only is she an advocate for women, but she's been through this journey herself. She can speak from both a personal perspective and also from a lot of the experience that the White Dress Project has had through the years. And just on the note of lifestyle, here at the Center for Fibroid Care, we are also looking at how to incorporate supplements, diet, nutrition, and how to study a formal plan in order to prevent recurrence of fibroids, because as many of us know, fibroids do recur. So it's very, very important that we study it, that we stay ahead of it, that we learn as much as we can about all modes of treatment. Okay, and so I'm going to refer to each of our panelists by their first name today. So Zamala is here, Holly, we have Tanya, we have Heather, we have Kristen, and we have Lauren on the computer. And Lauren, she really did not want to miss our event, but she missed her flight coming in from Florida, unfortunately, last night. So she wanted to tune in remotely. So on that computer is Lauren, and she'll be also answering our questions. Okay. All right, so I thought we would kick it off with the first question, which I think is probably a question that a lot of people have who suffer with fibroids. When did you first find out that you had fibroids? And tell us a little bit about how you found out.
Who wants to go first?
Who wants to go first?
I'm going to go first. It's very strange having this microphone on. So I was diagnosed with fibroids in 2018, so I think I was about 36 back then. But I started noticing symptoms a year before. First, it was frequent urination and chronic bloating. Like, I cannot tell you how bad this bloating was. Like, have you ever felt kind of bloated and tried to like suck it in? This could not like happen at all. I went to one doctor because I thought there was something wrong with my digestive tract, had a colonoscopy. He said, you're fine. I went to another doctor thinking that like I had pulled a muscle in my stomach. He says, you're fine, I've seen worse, which was not really nice to hear. I thought some of the bloating might have to do with my anxiety, so I started going to an acupuncturist. I'm like really big into holistic medicine. And that kind of helped, but I was also experiencing back pain, frequent, a feeling like I needed to use the bathroom, even like after I had just went. And I just kind of like sucked it up, and I kind of want to mention that because I think as women, a lot of times we're told like it could always be worse and that we're tough and whatever, and I didn't have insurance. So I was already spending a lot of money to see all these doctors and not getting any, answers, and no one told me to go to see a gynecologist. It was my acupuncturist who told me to go. Sometime in like the end of that summer or early fall, I woke up and there was a lump in the bottom of my stomach. It was about the size of a baseball, and I could press on it, and it was hard. Went to the gynecologist, and she's like, oh, you have fibroids. And I was like, okay, so like, what can I do? And she's like, well, usually you can have like a hysterectomy, which felt like very extreme. My mom had fibroids as well. She had a lot of fibroids. When I was a little girl, I used to think that once you got your period, you had it like indefinitely until you went into menopause because she was always bleeding. So I didn't really like that avenue, and so I was like, well, can I just like wait and see? And she's like, oh yeah, like you can wait and see. And and that's what I did, and my fibroids got worse. I'm gonna let someone else answer, but I'll tell you about what happened to me. Eventually, I'm sure that will come out.
So I found out that I had fibroids. I think I was 40, and I actually had I was testing my fertility, and they found a dime-sized fibroid. So we knew I had a fibroid. Okay, it's not bothering you, don't bother it. That's what I was told. So we just kind of moved on. Fast forward 4 years, and my stomach was getting bigger and bigger, and it was obvious that I needed to do something. Now, as a health and wellness coach, fitness instructor, all these things, I was thinking, I'll just exercise it, eat well away. I mean, and I was already doing those things, so it was somewhat concerning to me that I'm doing all the right things, right? This shouldn't be happening. So kind of kept monitoring it with my physician, my GYN. And I got to the point where, so I was one of those who was asymptomatic. I didn't have heavy bleeding. I didn't have any pain, intercourse, no urged urination, none of those sort of things that, are tend to be sort of prevalent. The biggest thing I had was when I did crunches on the floor, abdominal crunches, exercising, I could feel it poking into my back. So that was the only thing that was bothering me, aside from the fact that I would often get asked when I was expecting.
Oh God.
So, as was mentioned, it was 16 centimeters. And what was interesting, speaking of lifestyle, because that's of great interest to me, obviously, what I noticed was when I was being monk-like religious about my eating and my no alcohol and I could see the difference in terms of my belly. And then I remember this very clearly. I went to a barbecue, which was all meat all the time, and it was my college friends, so you know what happened. We did a lot of drinking, a lot of eating, and I literally came home from that weekend, and it was probably the biggest it had ever been. So so I realized that lifestyle was a factor, but I will say that as someone who does, work in health and wellness, it was difficult for me to come to grips with having a surgical intervention because I said, lifestyle can fix this, right? So that's a whole nother thing to go down in terms of how I did come to grips with that. But I got permission actually from my sister, who she found out she had fibroids and waited a long time. And so there is something to really kind of getting to a certain threshold of size of your fibroid to really think about doing something because there are ramifications to not doing it. So I will say that, and that's how I found out, and eventually I did decide and came to grips with it to have my myomectomy and surgical removal.
Hi, I'm very new to this, just found out last year, I think. Had no idea. I mean, I had back pain, need to urinate a lot, pain in my stomach, the lower abdomen, pressure, just feeling like there's something heavy in there. I always thought it was ovulation or something going on. Went to the gynecologist, just a routine sonogram, showed up with like 9 fibroids, so I was pretty surprised. Although my mom has had them for years, she's been suffering with them for years, so wasn't quite surprised then, but yeah, it's been a short journey for me, but I've made a lot of changes. My diet, exercise, alcohol, just a lot. So I'm still working through that journey right now. So.
All right, so for me, it started with endometriosis for me. That was my journey. In 2005, so I feel like I'm like the veteran in this group of challenges, but in 2005 I was originally first diagnosed with endometriosis, and only after I was ready to do the laparoscopy did the term fibroid even ever come into my vocabulary. At that point, I had no idea what endometriosis is. All I knew is that when it was time for me to have my period, the pain felt like I was swallowing a hot sore that was making me a new butthole. Like that, there's no delicate other way to describe it, and the only way I could alleviate pain was to be on the floor hunched over in the downward dog for yoga, which go figure is like my go-to now for pain relief. We'll talk about that later. But yes, and so when we were doing the laparoscopic surgery, discovered I had this humongous fibroid that couldn't have been addressed in that manner, because I'm sure Dr. Shirazian would go over location and the way that impacts treatment. But yeah, 6 hours into surgery, they realized that they can't do it. And that's actually how I met Dr. Shirazian in 2010 at a different hospital entirely, and followed her here. It's been a long relationship. But yeah, that was number one. I wouldn't hog the stage, but go along. But yeah, that was when I first discovered back in 2009. Yeah, that was February 1.
Thank you. I started, I think, similar to you, I've had like a long-term history of hormonal imbalance. Like from the time I got diagnosed with my period, it was very common for me, diagnosed. By the time I got my first period, it was very common for me to need to miss school. Yes. Very common for me to be in so much pain that I couldn't go to work. And similar to some of the stories shared here, organizing healthcare in the current socioeconomic climate, work climate has just been a nightmare. So there was the diagnosis in 2015 for me, and what sent me to the doctor to get a diagnosis was just more of the same, but at like increasingly shorter intervals. Instead of it happening like once a quarter or every other month, it was like every single month. And I was under a tremendous amount of strain in 2015 due to some life factors. So that first diagnosis was that I had 4 small fibroids, and the doctor recommended either watchful waiting, or you can do birth control, or you can go ahead and go for removal. But I don't recommend that given the size at this point in time. Fast forward, here we are in 2020, and I am doing all the things to get through it. I'm like eating all the things, drinking all the things. I've gained like 20 pounds, and my digestion has just taken a nosedive. And I couldn't figure out why all of a sudden, come 2021, I couldn't digest anything. So I'm like organizing healthcare again on the tremendous scale that takes when you work for yourself. And I saw a doctor who said, your situation is that you've got a very large fibroid sitting just behind your rectum, and it's preventing you from elimination. Now, that could potentially be a reason why your digestion is behaving the way it's doing, but we don't really know. So I saw an acupuncturist, and she said, why don't you get a second opinion? Because the location of all of these is kind of crazy. You could do myomectomy, which is what was initially recommended, but I didn't want that particular type of scarring. I wanted something more minimally invasive. And so I got rerouted and met Dr. Shirazian here and started my process here at NYU. And man, I wish I had had both the insurance and wherewithal to have had this happen for me sooner. I wish I didn't have to have waited as long as I did.
You.
It's your turn.
Lauren, it's your turn.
Okay, Victoria, can everyone hear me okay?
Yes.
Yeah.
Yeah.
Put your mic by the computer.
Yeah.
Put the mic, oh yes, by the computer, yeah.
Can everyone hear me okay now?
Where is the mic? I'm not sure that it does.
Go ahead, Lauren. Hold you.
I was diagnosed with fibroids in the summer of 2022. Many of my symptoms were very similar to what the rest of the panel has just described. I had a lot of bloating, weight gain due to hormonal imbalance, which I later found out through testing. Really what triggered me to go to the doctor was when I would lay down on my stomach, my belly looked lopsided, like there was a bulge on the left, and it was very hard and firm to press on it. And it just began to get larger and larger. So eventually I did go see a specialist, and I had multiple tests performed in which I was diagnosed with a fibroid. Where it became a concern was the size, and also the fact that it was potentially pressing on my urethra, which could affect my kidneys, which is when I was told that I would have to operate because it would just keep getting bigger and bigger, and if I didn't operate, eventually, potentially, my kidneys might get affected, and that was the major concern. So I saw a couple of specialists, and eventually that path led me to Dr. Shirazian. But,
Okay, thank you, Lauren. Thank you all, by the way, for sharing your stories. I didn't say that at the beginning, but I think it's extremely courageous of you all to share what you've been going through and the journeys and how you first got diagnosed. And I understand that many of these questions might feel very sensitive. So if anyone doesn't want to answer a question, please don't. You don't have to feel obligated. But how amazing for us to sort of get to share in your journey. So thank you again. Okay, so I guess one of the questions I hear a lot, and I think potentially maybe a lot of people are going through, is how do you feel like the fibroids have affected your relationships, if at all? Do you feel that they were something that affected your ability either affected your ability to do things with friends, just socially, or even potentially more intimate relationships. But do you feel like they affected you in that way socially? That you would change behavior based on the disease?
I can say regularly. I had to opt out of things at the last minute, cancel sometimes. And sometimes you, like in professional settings, I didn't want to have to explain, sorry, I'm bleeding too heavy to be in public today. Or sorry, I'm in too much pain, I'm throwing up, and it came out of nowhere just like that. Because I was fine 2 hours earlier, and now I'm face down in the toilet bowl. Like, I didn't want to have to explain all of that, but that was kind of my life. I remember the very first day of like my first corporate job at an organization, like the stress was really high. I didn't know a whole lot about all this stuff, and I got so sick and what felt so horrible. I thought, okay, I'll just like stretch out here underneath the desk. They won't notice. I gotta make it through today, and then everything will be fine tomorrow. They called the ambulance to come and like take me out because they were like, we don't understand what's wrong with this girl. And it was just my period being my period on a regular basis. So yeah, it definitely impacted me holistically in my life.
It's so like, I feel like my life is a carbon copy of hers, so much so that I didn't even realize that was a problem until you started to talk about it. I was like, oh, that wasn't normal. Like the not being able to attend classes when I was in college, and with work, they understood. I was with that company for 11 years, and they knew that I had really solid work ethic. But when Heather's knees hit, they were quite all right with me being in my cubicle. Just, it's all right, just do what you have to do, and then I'm okay. But that was just really absolutely normal. For me, though, the larger part about personal relationship, even aside from that, because it's like, oh, that's just life. My first major fibroid, and I didn't do them in the multiples that a lot of people seem to, but I did them really large. It created a hernia. And so I needed a hernia surgery to address that. But it made carrying and just doing a lot of things very, 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 very difficult because that just kept tearing. And then the other one was it affected my spine, which just led to larger things later on. But yeah, almost ditto. It's amazing how you just think that that's just normal.
Right.
That is really troubling. I was like, wait a minute, oh yeah, that isn't normal. Yeah.
Not only with heavy bleeding, but I found myself just getting a whole new wardrobe while, having fibroids. Just, you feel embarrassed, like your stomach protrudes. It's, even looking in the mirror, you feel like, oh, what happened? So I started wearing, just bigger, baggy dresses or clothes just to like hide that area. So, yeah.
I'm gonna jump in on that one. Yeah, pretty much what you said. I used to like to do circus arts or like aerial arts, which is like pole dancing and the lira and all that kind of, fun stuff that you can go to body and pole into if you're in the city. And I really loved it. I've always really liked to work out, and as like my stomach grew bigger, the last thing I wanted to do was be any place where people could see that and ask me questions, especially like any place where maybe people had made comments of what I looked like before, and I was rather small. I always kind of had not a great relationship with my body and kind of a poor body image, and I've been very militant about my diet and my workout routine. And like a lot of people here, I felt I was always doing everything right, and to have this like mass emerge that everyone could see, I was really ashamed by it. I had a partner at the time, and he was super supportive, but it definitely like impacted me wanting to be with him. Also, I was in pain. I could really feel the weight of that lump, or what were really lumps in my stomach. Yeah, I just got very good at hiding it. A lot of sweatshirts, a lot of big t-shirts, and yeah.
So I want to piggyback because the name The White Dress Project came from the founders. She's a fashionista and she wanted to wear white and she couldn't because of her heavy bleeding. So, so it puts a lot of pressure on us on the board because now we got to find something white all the time. But that's once you get over that hump, and now you got to wear white whenever you go out and represent. But I will add to that. For me, just as Holly said, as I mentioned, for me it was just this grappling with my identity. But this is what I believe, right? So that you do these things right, you eat right, you exercise, you do these things. Now, I will say that having explored it further, and I think it was mentioned in my bio, there is a holistic sort of approach that suggests that there is a stress link. And when you look at the research, you look at, adverse childhood experiences, major life events, and the relationship of that. And that's what I really began to explore after my myomectomy, and that was part of, what. So for me, just as a little bit of an identity crisis, trying to figure out, is my career over because I don't know if I believe what I'm selling anymore. So for me, that was probably the biggest thing because it affected me professionally. And actually the opposite, because I performed and I was a dancer and, I taught classes and stuff. I still wore the same crop tops and stuff. I know people thought I was crazy because I had this belly up to here. So either that or they thought I was actually pregnant because I was just like, I don't care. I was doing Rihanna before Rihanna. I was just like, whatever, but with a fibroid, not a baby. So.
Lauren, do you have anything to add?
Similar, can everybody hear me?
Yeah.
Similar experience. I think for me, socially, it really affected my social life. So I'm a very adventurous person. I love doing different types of sports and activities. I was actually on vacation with my family and wanted to go jet skiing, and I had the owner of the jet ski stop pull me aside and say, "Excuse me, ma'am, I'm sorry, but pregnant women are not allowed to drive the jet skis." And I'm like, I'm not pregnant. So just people thinking that I was pregnant and I was not. It's a fibroid. And just even having to explain my situation to someone is just kind of, it's extra. And then I would just say, like, normal activities like being able to go to the gym or be able to shave your legs, like physically bend down, right? So you have this bulge like in your stomach preventing you from being able to move certain ways. It just made lifestyle and social activities difficult. Walking became difficult for me. I would get a lot of back pain. So that was my experience.
Just thinking about what everyone has just said, I wonder, is there one thing, if you could pick one thing, that you wish that someone had told you about fibroids early on? Like something you didn't know that you wish you knew at the beginning?
That they can
I
get
know I just threw that one
that they
out,
can
but-
get bigger and multiply. That I'd always heard, the wait and see thing. They can shrink on their own. I'm not a doctor, so I am not going to give you a statistic how likely that is. But if someone had told me that the 4 fibroids that I had were going to turn into 22, and I was going to have a uterus the size of a second trimester pregnancy, I would have just saved the money and had it done back in 2018 and not last year.
Well, for me, it is the connection with stress, which has just been an area of interest for mine for a while. And there are statistics around stress, and it being the sort of underlying cause, a major cause of a number of conditions and chronic diseases. So, this attention that I paid to exercise and nutrition and, I'm also a bad sleeper. I'm just gonna put everything out here now. So, and not really focusing on sleep and how important that is really in stress recovery. So really, I think that that's something that I wish someone had kind of maybe tapped me on the shoulder and said, you might want to consider that too. I will also bring up that we at the White Dress Project did a survey last year, and we had about 1,000 respondents. And of the sort of natural, quote unquote, lifestyle methods that people tried, the one that was deemed most effective, meaning they scored it extremely to somewhat effective, the most were stress management techniques. So whether that's yoga, if you're, first of all, restorative yoga, if you haven't done it, do it, your life will change, your sleep will change. That focus, I think, is something that I would have liked to have known, and I actually think could be, promoted a little bit more in terms of a focus on how you're addressing, the stress and the recovery from stress in your life.
I know that's a hard question.
I have also a background in health and wellness. I trained as a health coach and worked as one for 5 years. And so I have known about the connection between like food and diet and exercise and symptom, like having symptoms. I just wish that I hadn't had to learn that outside of my doctor's office. Like I wish somebody had said to me, listen, Kristen, here are the foods that are going to elevate your inflammation. We already know that from certain inflammatory markers, this is going to cause you more pain, all of this stuff. If I didn't have that background in training, I would have been in an internet rabbit hole late night, stressing myself out more, trying to figure out what's true and what's not, which frankly I have been since anyway. So I think, I really love the work that you're doing, Dr. Shirazian, because it is about like, how do we make sure that it's a holistic approach? And I wish I had had a doctor tell me that, not just a doctor say, so we can cut you open.
That's great. I appreciate that.
Yeah. I don't know that there's anything that I could have done differently, but then our path has been intertwined for 13 years, right?
Something you wish you knew.
Well,
at the beginning, no?
that's the thing, because so when hindsight is always 20/20. I first get diagnosed with endometriosis 2005. I was an environmental consultant at the time, so I was very much aware of like environmental impacts and how those things can influence how your body is receiving those sensitive receptors. That was something that I was dealing with work on a daily basis. In those days, I lived in Long Island at the time. There was this store called Wild by Nature that existed. Whole Foods wasn't even a thing then. And eating naturally and organic, that was not a thing. And if it was, I need another mortgage payment to be able to pay for anything that was, so that just wasn't a thing. And then, so I did all those things. Like I really can't think of anything, because then when we met in 2010, it was myomectomy time essentially, because I had a hernia that was going to keep getting worse. I couldn't keep dilly-dallying on that. We had to fix that before that got done. So I don't know that there's anything that could have been done differently for me. Yeah.
I'm not sure, how that affects fibroids, but I do know hormones play a part with women. A couple of years ago, maybe 10 years ago, I was told that I had really high estrogen, and no one told me that maybe it could lead to fibroids or other symptoms in the body. And I wish I knew how to really balance my hormones on my own or do things differently. So yeah.
That's great. That's a good. Yeah. Is anyone? I wanted to open it up because I know I'm asking a lot of questions, but I was curious if anyone has any questions at this point. We have a lot of, I see a hand over there. We have a lot of other possible questions, but I think it's always fun to be interactive. Is there a question?
Hi.
Hi, welcome.
Hi, my name is Sharmila. I found out I had fibroids. I think I knew about it since my 30s. I'm 42 now, my early 30s. My mom had it. She had a hysterectomy, and I saw that whole thing, and I was like, oh my God, it was like a little scary to me. And the doctor was like, you're okay, most people have it, it's not a problem unless it grows. So kind of didn't do anything for a while. Then my period started getting longer, heavier, more painful. I started having to explain to like 10 different bosses. Right? My whole, medical, it was so horrible. I have the pregnant questions, I wear the scarf to cover my stomach so that hopefully people don't ask it, right? This is my life right now. And I'm trying to decide which way to go. Traditionally, I hear myomectomy, hysterectomy, and I've just been holding out because I've been hoping for like some miracle treatment to come out. And about 2 years now, I heard about UFE, and with the way that I feel about surgery, and I waited so long. My fibroids are huge, they're like a watermelon right now. I think multiple. I just walk around like I'm pregnant with my stomach. So I wanted to I was hoping coming here today would really help me get that. Yeah, go and do that UFE and don't be afraid, right?
Yeah.
Because if I have to do surgery, I have to, but I'm just really hoping that there's another way to deal with it. Because to be honest, I'm just not that brave. Maybe I could be brave, I guess, if I told myself, but it was life-threatening. And it might get to that at this point if I let it keep growing, to press on all the other organs. So I heard someone may have done that procedure, and I'm just kind of curious. I'm worried about the pain after I hear this intense pain, and I'm like, well, what is that? Because I've been in intense pain for years now. It's true.
That's a great question, Sharmila. So maybe we could speak about what people have tried, how they felt making that decision, and sort of what went into choosing the option that they chose. Yeah.
Okay, I'll go. I had a treatment called the Sonata treatment. It's radiofrequency ablation. So it's not surgery. Do you want to explain? It's a procedure where heat is directed to the fibroid and it shrinks. There's pretty much no recovery time. I went in on a Friday, left the hospital the same day, minimal pain, maybe a little cramping, period cramping, just a little. But the next day I was walking 10 miles. So I'm very satisfied with the treatment. Although Dr. Shirazian said to me, it may not work on huge fibroids, but I told her anything to shrink the fibroids small enough so I may have surgery or another option later, I would take, because I was scared like you too. I did not want to go under. But it's been 7 months and my fibroids they're half the size they were when I first went for the treatment. So I would recommend it to someone who doesn't want to have surgery.
So the pain was okay?
Very, very minimal pain. We already suffer from heavy periods and pain. So it was just a little cramping when I woke up. But other than that, I was good to go. I was walking, running the next day. So, yeah.
And
Go ahead. You go.
I'll just piggyback on that to say I also had the Sonata treatment, and there was a laparoscopic surgery performed for me to remove endometriosis as well. And I will say my experience was that the level of pain that I had with my period prior to the treatment and what I experienced post Sonata I didn't even need drugs. Like, that's how manageable it was for me, because the way my period had gotten me to a pain threshold tolerance prior to it, I was shocked how manageable it was, how like ready to go I was. Like, my mom flew in and she was like, sit down. I was like, no, I'm able, let me do it. So it was such a wonderful experience for me. I would highly recommend it. If you've got the insurance for it, get it done. You will be so grateful you did. My periods are lighter on the back side of this. I actually don't need as much pain medication on the back side of this. And it's not even been that long. I think it was February we did this. So I can't say enough good things about how well it went for me.
I don't think I can accept because of the science right now, but it is helpful to hear you all speak about the pain after, because that's one of the scariest factors.
So,
Well, sure.
Laying in the bed, like I'm a hospitalized person.
Well, Sharmella, we also have two of our IR doctors here who can speak to the procedure and can help you understand a little bit about the post-op that they've heard from their patients. So I don't want you to think we're not going to talk about UFE, because we are. But I think before we do that, the big thing is my goal is that no one be afraid of any treatment, honestly. Like, that we help explain what's involved in whatever you choose, and that you feel empowered to make those decisions, and that fear doesn't dictate not doing anything, right? We don't want fear to really, as much as we can help educate and empower, we don't want fear to enter the picture. I think that's the biggest goal.
and this may be counter to that. It's not about the treatment, it's about not treating it. And my sister gave me permission to share her story, but she didn't get her fibroids addressed. I just came today from her 5th chemo session. And not that, again, I don't want to, please don't leave here thinking the fibroids turned into cancer. Did not say Tanya said that. But I think we would have found the cancer earlier, 1. 2, she actually had a blood clot. So she had a DVT that they believe was linked to the fact that the fibroid was pressing on some major blood vessels. So there are some ramifications to, especially when it gets to a certain size, not doing something. And so you're just weighing that, so that fear, there's a lot more down the road. So just in factoring that in, because as you said, you could be candidate for Sonata. If you're not, you could be a candidate for UFE. So you have to figure all that out, but also realize that doing nothing, certainly doing nothing, definitely keep investigating, keep exploring, because doing nothing also has its downside.
Yeah, my goal is to make a decision after today.
Okay.
We're here for you.
Exactly.
Yes.
Okay, do you, Dr. Kulkarni or Dr. Morse, do you guys want to speak about UFE here? What people can expect maybe after the procedure?
UFE or the ablation? Because we were talking about the ablation.
Uterine artery.
Yeah, so I can talk a little
Same
bit
thing.
about the embolization. My name is Liz Morris. I'm one of the interventional radiologists here at NYU, and we are we work with the OBGYNs to take care of patients just like you. And our office hours, we hear your stories again and again, but still your stories are new and different and teaching us a lot about the kind of patients we take care of and what you guys have to go through. My colleagues, Dr. Liu, Dr. Kulkarni, also take care of patients like you. And so first of all, thanks for having us be here, and thanks for everybody for attending, because there's a lot to learn. We do a particular procedure called uterine artery embolization. It's a treatment for fibroids. It's a minimally invasive option for women who would choose not to have surgery or for patients who are not good candidates for surgery. And it offers great symptomatic control for bleeding and also about 50% decrease in size of fibroids. And so our patients at about the 6-month mark have a significant decrease in the size of their fibroids, and well before that have serious changes in their periods. The recovery is what we always talk about with fibroid embolization. Unfortunately, there is pain with it. The wonderful thing about a fibroid embolization is that we treat all fibroids in a single session, but the downside is that there's a few rough days after the procedure, and we haven't figured out how to fix that yet. We are always trying, we're meeting with the pain management specialist to try to learn how to send our patients home with better, more comprehensive pain management. It's a work in progress. But we'll get you through it. We get a lot of people through it. And I'm sure I told you this during our office visit, and I tell a lot of patients this. I don't care what you do. I don't care if you come to me. I don't care if you go to Dr. Shirazian. I don't care who you see, as long as they're a good doctor. But I just want you to do something because it's not worth suffering. You're suffering too much. Your lives are affected too much. And you gotta just do something. And it doesn't have to be me, and it doesn't have to be the embolization. You do what feels right for you. We are living in an age where there's a lot of options, which is wonderful. And I think a big part of this, the Fibroid Center, are those options, and that women do have options. And there's a whole spectrum of things that you can do, but you gotta do something, okay? All right.
And I would be curious, you guys' perspective on this, because this is something, my partner at the White Dress Project is an IR, and one of the things we talked about, and my sister had a UAE before she had the hysterectomy, which wound up. And so there's not a mutually exclusive either, right? So if you don't want surgery, I know that the pain is your question, and this is all about you and what you want. And thank you for saying just doing something, but there is the concept of kind of doing a little combination where you see how the UFI works for you, and then are we going to talking the same? Okay, so I just wanted to make sure the doctors can confirm, but yes, that I feel like a lot of and again in our survey, the thing that people most wanted to understand were treatments because they're in the same situation that you are, and we spin. And we go into analysis paralysis, and it's like this, and it's this, and this. And it is not a mutually exclusive, like, you do this, and you're locked in. So pick what's right for you, to the point, do something, but yes, factor in all of the things, but it's not, oh my gosh, if I don't make the right choice, it's whatever's right for you at this time, especially to deal with whatever your symptoms are.
Yeah.
Yes, I think that is an amazing, amazing point because, it's really all about, I think, a lot of it is about combinational therapy, right? We know fibroids come back. Yeah. We know that fibroids recur. So if we choose, a minimal procedure now, it's possible those fibroids are going to come back in 5 years, in 7 years. And so thinking about ways to combine therapies both now and in the future is very, very important. How can we achieve the best outcome for you today, but then also set you up for success later? Like someone said, oh, I wish, I knew about the fibroids when they were smaller. Maybe I would choose to do something about them when they're small, right? Which I think is great, which, fibroids that are tiny, maybe we wouldn't do anything about, but a moderate-sized fibroid, maybe we could shrink it. Maybe we could use medication to minimize the growth. We do have newer medications now that actually can slow the growth, improve the periods. We have transcervical fibroid ablation that is more effective if the fibroids are, a little on the smaller side, less than 6 centimeters. So, we can combine these therapies both in one surgery as sort of...
That was my situation. I kind of cherry picked some stuff. I was like, okay, so for the one in this location, I want you to do this. For the one in this location, I want you to do that. And for the one in this location, it was really 3 different things I had going on. And I mean, I think the gift of knowing that you're in good medical hands is your doctor doesn't go, I'm sorry, we can only do one, or, you know, there's nothing we can do for that one. You have to do it all this way, which is what my original doctor told me. There was only one option for you. And so thankfully I found myself like getting directed to you, and you were like, so here are all the options. What do you want to do? And that really empowered me to go home, do my research, understand what the impact would be for all of the treatments that she had recommended, and then come back and say, this is what I want to do. And even on the day of surgery, you're like, so you sure you want to do all of this? And I was like, yes, ma'am, let's go. And so she was like, all right, I'm down. If you're down, I'm down. And that made all the difference in the world. It made me feel very empowered to know that I wasn't at the mercy of the circumstance and the diagnosis. And I think that's really what was the game changer for me, that had me feel like I can go forward and do this.
Lauren, we haven't heard from you in a little while. Is there anything you want to add to the conversations?
These poor women.
Sure, yeah. So I second everything that everyone is saying in terms of making sure that you explore your options. If you're like me, do not 100% rely on Dr. Google or Dr. Wikipedia. Make sure that you speak to a licensed professional, because that's one thing. I would see things on the internet and forums, and it's great that you're able to hear those stories from different people, but make sure that you are seeking advice from a licensed medical professional. I know that when I was down south, I saw one surgeon who also kind of made it seem like I only had one option. Even everything from the incision, telling me that my fibroid was so big that I could only have a vertical incision. Whereas when I went to New York, I was told, no, you can have a C-section incision, right? So realizing I had different options even for the type of way they were going to cut into me. And I'm sorry if I'm not using the proper medical terms. Medications as well, there's so many options for that. I was told one thing down south of having, I think it was Lupron, but there's a new generation of oral medications that you can take that don't have the same side effects, for example, that can also potentially help to shrink the fibroid and help with your menstrual cycle. So all in all, I would definitely say that it's good to be proactive and definitely take care of it. The longer you wait, the higher the risk there is, I think, for other potential complications. So you do want to make sure that you address it. But don't believe everything you see on Wikipedia. Speak to a doctor and make sure that you know that you have multiple options when it comes to the surgery and the medications.
So can I, it was brought up, see a good doctor. And we have a lot of good doctors in the room. Like every profession, there are not so good doctors. I'm just gonna, I don't. Sure. So one of the things that we also asked about, and I was gonna bring this up, is how many doctors in our survey women had seen in order to get diagnosed, in order to figure out what treatment they were going to get. And we ranged, I'm sorry, I had this up and I was going to keep it up. It was okay, so to diagnose, on average, it was 2. The highest was 30 providers. Oh my God. To discuss the information to figure out the treatment, it was, the average was 3 and the highest was 26. And then to actually figure out the doctor that would do the treatment, even once you had decided on a treatment, the average was 2, but the highest was 21. So, I think when you talk about being comfortable, like you had Dr. Shirazian and she was like, okay, you want to do that? That's what we're going to do. If it's possible and that's what makes you comfortable, that's the perfect. Sometimes that's not the perfect. It's not the perfect scenario. But, one, your stress level goes up. That does not help with your outcome. So you want to have someone that you feel really comfortable with. And it is work. It is unfortunate in the healthcare system we're in today, but there's work involved in finding the doctor that's right for you. But just know that once you find that person and you have the treatment that works for you, that it makes the world of difference, both from the symptoms that you're experiencing as well as the overall outcome, in all honesty, that you have. So thank you again to the Fibroid Center, because this is information that we as a White Dress Project are really looking at, helping to educate physicians, in all honesty. I just read an article that said that, to be honest, of the, I think, 1,000 OBGYNs roughly that they surveyed, only 2% of them even mentioned UFI as an option. So, our philosophy, my partner is an IR, of course, she says, if a doctor tells you there's only one option for you, that's not the doctor for you. Full stop.
Thank you. Thanks for doing that research, because I think obviously we need to do more research and understand better, outcomes and long-term goals and just a lot related to fibroids. So I wanted to see if there were any other questions. Yeah, I didn't want to get too late without.
Hi, how you doing?
Do you need this, by the way?
I can project. I'm actually like shopping. Yeah, I have the scarf too.
Oh, wow.
My name is Shirazian, actually, and to segue into what you were saying, I probably have seen maybe about, if we're in New York City, I've been to NYU, Columbia, New York Presbyterian, Montefiore Health and Hospitals, so every single hospital system that we have in New York City, I've probably been to. And interesting enough, I have met with some really good physicians, and that comfortability is there. But one thing that I haven't heard, and I just maybe want you guys to talk about a little bit more, is the fertility factor. So I know that, the myomectomy, the hysterectomy, the UFE, I just read literally today about the embolization, that one, the one that you did. That one, but yeah, I'm her, so I can't, this is big. But fertility and how that impact your decision, because I think that's one of the biggest things with this journey that I've had. I've had it for a long time. I kind of knew the wait and see. I got the wait and see message, did the birth control. I'm 42 now, so it's kind of like, where's fertility, incorporating, and I didn't know that IRs and GYNs really should be working together so closely in this process. And then okay, the other factor of the fertility doctor and doing the eggs and all of that stuff. So just kind of that part.
I gotta say one thing first, is that at the Center for Fibroid Care, we actually send out this questionnaire. We're also collecting data, just like Tanya. It's a quality of life questionnaire, and it's a life goals survey. So we sent out 2. They're electronic. They get pushed out through Epic, through our Epic system. And what we've learned is the number one life goal is symptom elimination, but followed very closely by fertility. So fertility is on, I think, many people's minds when they come and see us at the Fibroid Center. And you are not alone, because also the average age of our patients is roughly 42.5. So we see women of all ages, but here in New York City, here at this center, we see older women on average, and many want fertility and many want symptom elimination. So I just wanted to share that.
We just did, we have a research forum that we do as part of the White Dress Project called What the F, and the F stands for fibroid, just so we're clear. So we said, what the F with fibroids and fertility, and there have been a number of studies that have been done, and I think that when you talk about, especially the particularly the treatments we're talking about, ablation, myomectomy, UFE, there has not been enough sort of long-term study, because when you talk about right after, obviously uterus needs a chance to heal, etc. So there's not a lot of research, but generally everyone in those categories, according to the research, has been able to get pregnant. So it is possible. Now, given the fact that there are umpteen other factors involved in fertility or infertility, the other side of the Y part of the equation, and then anything that might be for you, it is difficult to say, hey, you get this and you will not be able to. So that's, if someone tells you that, then that's, again, according to the research that we've been really mining for this session, it is available on YouTube, White Dress Project. Um, so just generally, as you're thinking about it, I think there's been some conversation which we've determined from the research is incorrect around euphy and the fact that that it is not as conducive to fertility as myomectomy, but the research does not bear that out, just so we're clear about that. So again, when you talk about fertility, hysterectomy, it's out. You're not going to carry. So I think that's the only thing that's definitive because you have, your uterus is gone. But so just to add that research element to it, which is that there is, not enough long-term study, but that all of the major buckets, I will say, even ablation, and some people will say ablation, well, you're disrupting the lining, but again, the studies have shown that people have gotten pregnant after ablation. And I will say that on that fertility call, we had a woman who carried her baby almost a term. I think it was 34 weeks. Don't quote me, but it was close. 26 centimeter fibroid with it. So anything is possible. Now let's not say the likelihood. So again, just as you do think about that, and we had some fertility and reproductive specialists, but because there's a myriad of things that can factor into fertility, but it looks like at least the major treatments that we're talking about now don't prohibit it except for hysterectomy.
Just a few things to say about that. So we were not talking about endometrial ablation. We were talking about fibroid ablation, which there's a difference.
Right.
Just because people ask me every day.
I apologize.
Endometrial ablation actually gets rid of the endometrium, and fibroid ablation targets the specific fibroid and shrinks it. So, to know that difference, I think is important. But we work with our REIs because really fertility is about individual planning, and I think just developing kind of your own personal plan for what you want to do, understanding your own egg count, age factors into it, right? Other medical issues, past pregnancy history. So we know there's so many variables. So when it comes to fertility, we have our REIs here in the building, so we work in conjunction with them when we think about, an individual woman's fertility goals. But I think, yes, independent of what you choose, people get pregnant. And women get pregnant with huge fibroids. Many do. Many people don't know they have fibroids and get pregnant and deliver. So we can't say that fibroids would prevent you necessarily from getting pregnant either. So I think there's lots of nuances to it, but knowing your goals and kind of working with you specifically, we can achieve the best outcomes that way. I don't know if anyone else has
Well, that was one of my questions before I did the ablation. I had probably 50 questions in an email to Dr. Shirazian. But I did my research, and fertility was my top priority. Maybe because also with surgery, there's a risk of anything going wrong with surgery, so I wanted to try the procedure that was very minimal so that I could try getting pregnant after.
Same.
Any other questions?
Has there been any study why they grew back?
Oh.
Why they
grew back?
Oh, why they grow back?
Yes.
Well, so then we get to sort of the causative factors for fibroids, and there are many. We have many things that we think are responsible for the initial growth. Things like, genetics we know play a key. Estrogen dominance may play a key. Environmental factors may play a key. So because we have so many variables that might contribute, there's no one thing we can point to that say this is the cause. This is what we need to fix. If we knew that, I think that would be that would be like the magic pill, right? We would be able to tell people you can take this, they won't grow back. But that's why we're trying lots of different therapies, and we try nutritional management and lifestyle management, and this study that we're doing actually looks at all that after a procedure or surgery to see if we can prevent them from growing back. So so we are investigating.
So we have Dr. Ayman Al-Hendi. I don't know if you're familiar with his work. He's coming to present some research. He's out of the University of Chicago. And his focus has been on secondary prevention, which means after you have a fibroid, really trying to investigate lifestyle. So his research has mainly been around vitamin D, which we'll be talking about, which, again, not sure if it's causative, but there has been a linkage between low vitamin D and fibroid, existence and recurrence. And so I think that's something else. His other research has been around EGCG, which is the active ingredient in green tea extract. So again, we're having that next Tuesday, I think, so he'll be presenting his research. So again, in the spirit of not doing absolutely nothing, even if you're frozen with regard to a procedure, make sure your vitamin D levels are at the right place.
In a good range.
In a good range.
Okay.
Sorry,
Oh, yeah.
This came up. You're talking about holistic and wellness and stuff. Is there any, and then like the doctor really kind of solidifying it, is there any truth with natural remedies, whether it's teas, whether it's all these different things out on the on the market, like in the sense of whether if you have small ones and you're like, okay, they're small, I can manage it, let me take this. Obviously, they say you gotta do something, but is that really something, is the holistic approach something?
Well, that's why, we're studying this specific combination of supplements, diet, and exercise. It includes vitamin D and green tea extract. It includes anything that has some data that's been published, that has evidence-based data. So that's how we came up with the plan for the holistic management. I think you can find some data that says it does work, and you can find data that's less enthusiastic about it, right? So it's sort of looking at it in larger numbers and seeing really does it pan out? Because if we could develop a good plan, let's say that either prevented small fibroids from growing or prevented them from coming back, that would obviously be a huge deal. So I think there is some data, but it's not like a large study. There aren't large studies, and there aren't, they don't follow them that long. That's the other big thing. So we don't want to hang our hat on things and tell people to buy things or go to the market and stock up on these holistic or natural ways. It's a lot of money. It's a huge business out there, right? So if we're not sure if they work. So as physicians, I think that's what we grapple with. If I'm telling you to go buy the, holistic medication and it doesn't work for you, you're going to come back to me and be like, that did nothing. My fibroids are 3 times the size. So, we have to study this to make sure that it's effective. Yeah.
I'll speak to that also, having lived the majority of my adult life so far outside of access to medical care on a regular basis. I'm like an edge case where I'm like, you think it works? Great. I'll look at a quick study. If I like the way the study was set up and the way they came to the conclusions, I'm trying it. I will buy it. Like, I personally feel very comfortable doing experiments in the laboratory of my body around what works and what doesn't. But that's my comfort level and the way my life is set up. It's something you're also really going to have to look at for yourself. 2 things. One, will it cause harm? If in fact it doesn't work for me. I've always stayed away from things that could cause harm, things that are just out there that could work, but if it doesn't work, I'm no worse off than what I am now. I'm diving in, because for me, hanging on to insurance at what it is for me at this moment in time is like, okay, this is an unsustainable amount of money. Like you were saying, like for you, for her, it's like the supplements and all of that is an extra mortgage. For me, it's just the monthly insurance payment. So like be in this room is an extra mortgage for me. So, you got to kind of really look at your own life and assess, can I look at the research? Can I take the research to a doctor who's going to talk to me about the research that I found? Like, can I print this out and take this and have somebody parse it with me if I don't understand it? That's something that's also really important to be able to do too.
For sure.
Okay, I think we could spend some time just mingling. And if anyone has questions but they don't want to ask it in front of the group, we have our fantastic panelists. So we can, do you want to ask it now?
Yeah, I had a quick question.
Sure.
I wanted to ask you because in my case, they were given the impression that I would see this. Fibers play a factor in anemia. Because they was getting the impression like, oh, but when they came up to me, like 3 or 4 doctors I saw, they wanted me to do regular spot hysterectomy. Oh, you don't need it, you're not using it because you're advanced age. So that was more like an issue for me. So I wasn't really too sure because they didn't present me with any information regarding that.
Yeah, well, I'm sorry they didn't explain that in more detail, but depending on where fibroids are located, they can create a number of different types of symptoms. And if fibroids are located in the endometrial cavity of the uterus or, kind of compressing the endometrial cavity, they can create a lot of heavy bleeding. And sometimes if you have lots of fibroids even, it can create very heavy periods. So you can become anemic from your fibroids, but not everyone has anemia who has fibroids.
Right.
I think that's another big myth. Well, I don't have heavy bleeding, so my fibroids aren't bothering me. But if they're very large, maybe they're creating other problems that you've adapted to. Right? We didn't talk a lot about adaptations, but I think women are amazing and adapt to everything, right?
Yeah.
So I think yes, the answer is yes to anemia, but not everyone has anemia.
For sure.
And I wanted to just give a shout out to my whole Fibroid Center team who's here. So we have all of our doctors here in the front row. Can you guys just hold your hands up, everyone? Yeah. So if people have questions, they can ask our team, our physicians here. And then in the back, I have Holly. Holly, give a big wave. She's our NP. And I think Ashok may have bowed out now, but she's our nutritionist. And we have our staff in the back. Back there, there's Glenda, there's Kathleen, and Carmen, who's somewhere, who helped put this amazing event together for us tonight. So I just wanted to really, really thank them. And last but not least, certainly our amazing panelists. Thank you all so much for coming and for sharing your stories and for helping other patients on this fibroid journey, because that's really how I see this. So many women are going through it, and for you to come and share your real experiences and your perspectives is invaluable. It's so, so wonderful. So yeah, so we're all going to hang out, and if anyone has questions, we can chat one-on-one. Thank you all so much for coming. Thank you.
Thank you.